Hi, Dr. Riaz Agha here at Harley Clinic on Harley Street. I wanted to talk to you about the major shapes of implants that we use. So anatomical versus round versus ergonomics implants. So what's the differences and what does it all mean? Well, this is a traditional anatomical implant. It is textured because one of the issues with it is that it can move. So if you have a look at that, it's got that typical straight slope. So it's a straight slope, it's anatomical. The idea is that it's shaped like a breast, but it's a fixed construct. So it's got to be heavily textured and it can move and rotate. So obviously if it moves, the shape changes and that would necessitate a reoperation. The chances of it moving are in those who are having reoperations, who've got issues with their pocket. It doesn't tend to happen as much with a primary surgery, but it could still happen. Rotation is the issue with those. And they're really for those who want a natural result. The alternative is a round implant, which you've got here. So this is round, so whichever way you place it, it is complete round implant, like a circle. So it doesn't matter if it rotates, it's still going to maintain its shape. It does have a slight gravitational effect, but it's got major amount of fullness at the top. So this is a Motiva round implant. Yeah, it's good for many people, especially those who want a more augmented appearance, more of a fake look. So they could go for the round implant like that. It is fuller feeling as well and has that difference in shape. And then finally you've got ergonomics, and here we've got Ergonomix 1, Ergonomix 2. So ergonomics is a type of implant that Motiva have come out with, where they're trying to get the best of both worlds with this. They're trying to have a shaped implant which naturally forms a shape inside. So when you put it in, the majority of the silicone descends to the bottom. You have more of a straight line at the top there. That's an ergonomics implant, so it forms more of a natural looking shape, but it's still round. So if it rotates, it doesn't matter. You can't change the shape. It doesn't require reoperation, unlike with this one. And then the difference here with the Ergonomix 2, which is this one, is they've just come up with a softer feeling implant. It's just softer. So it's the same as Ergonomix 1, but softer feeling. So it gives you, again, it's more towards a natural shape. Again, you still get that natural shape, straight line slope at the top. The peak of the implant is at 40 to 45% up from the bottom. So it's more of an anatomical shape like what we've got there. Doesn't matter if it rotates, and it's softer feeling. So this is someone who wants a really natural shape and look and feel, then they're gonna go for that. If they want a firmer feel with a natural shape, they can go for the Ergonomics. If they're going for an augmented look, then they go for a Motiva round implant, for instance. So that's what I'd be using there in terms of general options for a patient.